I want to welcome folks to the Rulemaking Advisory Committee and the Fiscal Advisory Committee, the RAC-FAC for today. It's meeting number 4 for the Toxic Air Contaminant Review and Update Rulemaking. We're just going to give another minute or two. Welcome, Mary, to see if we get a few more of our RAC members in, and then we'll start our meeting. For those of you on the rack, looks like everyone. Mary, I'll ask you it looks like you're in the vehicle, but if you can change your name and affiliation when you get a chance, that'll be wonderful. Thanks. Welcome, Jim. Welcome, Beth. Welcome, Liz. Travis, welcome.
Good morning. Thank
Good
you.
morning. Why don't we kick it off, and then we'll by the time we get to introductions, hopefully we'll have all of our rulemaking folks here. Jared, do you want to open the meeting for us?
I do. Good morning. Good morning, everyone. And welcome to our final meeting for the Toxic Air Contaminant Review and Update Rulemaking. Again, I'd like to extend our thanks to you all for participating on this committee. I know 4 meetings is a big commitment, but this is an important rulemaking that will have considerable impacts on especially the CAO program. We've had some excellent discussions and received valuable feedback from you all during this process, and we hope to continue those discussions today. All the information that you provide will be used to inform any updates the agency makes to the proposed rules ahead of the formal public notice for this process. Today's discussions will be focused on proposed implementation topics and potential fiscal impacts of the proposed rules. Hopefully you all received the email with links to the agenda for today's meeting and the materials for review, including the draft fiscal impact statement itself. As a reminder, in today's meeting, DEQ staff will be presenting information and seeking input and discussion from RAC members. Agency staff will provide clarifications on discussion topics, but will leave the bulk of the discussions to be facilitated among the RAC members themselves. And for this facilitation, again, we have with us here today Angela Hesenius and Ben Duncan from Kearns and West to facilitate the discussions. Finally, I need to inform you that today's meeting is being recorded so that we can post it to the rulemaking webpage so the public can review today's discussions. With that, I will turn it over to Ben to get us started.
Great. Thanks, JR. And yep, for the record, Ben Duncan with Kearns and West, your facilitator. I'm going to move through a bit of housekeeping to get us going, and then we'll jump into the conversation. As a reminder, and as JR just said, this is a recorded meeting. It's a webinar, and so only our panelists or our Rulemaking Advisory Committee members have the ability to speak. Those of you who are joining from the public, we have, of course, audio participation, but you cannot contribute. We will open up space at the end of the meeting for public input, but you will not be able to participate in the discussion, nor do panelists have visibility into the attendees. This, as JR said, will be available on the ATSAC website after today's meeting. We also have closed captioning available if it's helpful for your participation, depending on your Zoom. You could either click more at the bottom of your screen, and there's a CC button that says Show Captions, or you may have a CC button on the bottom of your screen. If you click that, closed captioning is available to help you participate. We do not have chat enabled for this conversation, so we'll just ask folks to bring their perspectives into the room. We also have disabled Q&A, so it really is meant to generate discussion and transparency for the folks watching online. And then finally, we'll move into introductions, and I'll ask folks to give their name, title, or affiliation as we move through that part of the agenda. So let's move to introductions. I'm going to start with our agency representatives that will be either speaking or presenting today. JR, or let's start with Ali, if you want to kick us off and introduce yourself and say any extra words that you'd like to for the group.
Sure. Thank you, Ben. Again, I'm going to break your rule of I'm not presenting or having heavy participation here. I'm observing. So thank you again. Ali Mirza Khalili. I'm Division of Air Quality Administrator here at DEQ. I'd like to welcome you once again to but it's last RAC meeting, and I want to thank you for the time and energy you've put in the process. This has been a long haul. We've asked a lot of your time, and we've asked a lot of your energy, and you've given us that, and I want to thank you for that. It's a heavy topic. It's a as JR mentioned it's a very important part of CAO and Clean Air Oregon program, and we really want to get it right. And so we really appreciate your involvement, thoughtful comments, and participation in this. And the process will continue. This is not the last opportunity for comment and involvement, and we'll fine tune it as we go along. So, well, thank you again. Well, I'll just turn it over to Ben. You can kick it off to the next person. Thank you.
Thank you, Ali. JR, you want to reintroduce yourself? Say hello.
Yeah, great. Thank you. And I apologize I did not introduce myself at the beginning. JR Giska, I'm the Cleaner Air Oregon Program Manager.
Good. Thank you, Mike.
Hi, I'm Mike Polson, DEQ toxicologist, been involved with CAO since the original rulemaking.
Thank you, Mike. Clara? Oh, I saw you out there, Clara. Oh, there you are.
Good morning. Technical difficulties. I'm Clara Funk with Oregon DEQ, working on the rulemaking. Thank you.
Thank you. And then David?
Hi, David Fair, toxicologist with Oregon Health Authority, and I've been involved with CAO from the beginning also.
Good. And then if there's any other agency folks that contribute to the conversation, I'll just ask you to please introduce yourself when you jump in. Now let's move to the Rulemaking Advisory Committee introductions. I'll just get in the order of the list I have here. Travis?
Yes, Travis Quarles with Bridgewater Group Air Quality Consultant.
Thank you. Charla? Charla here. Okay. Jeffrey?
Hi, this is Jeff Titchener with Phil Reeves, industry representative.
Thank you. Jim?
Yeah, good morning. I'm Jim Spar. I'm the environmental director for Cascade Steel.
Thank you. Cassandra?
Cassandra Jackson with the Port of Portland.
Thank you. Crystal?
Crystal Weston with the Oregon Environmental Council.
And I think we have Liz from NEDC.
Yep, Liz from the Northwest Environmental Defense Center.
Great, thank you. Cheyenne Verde, I believe.
Yep, Cheyenne Holiday with Verde. Good morning.
Morning, thank you. Molly?
Molly Kyle. I'm a professor at Oregon State University and an environmental health scientist.
Thanks, Molly. Mary?
Hi, Mary Pivotal with Neighbors for Clean Air.
Great, thank you. Nadej?
Morning, folks. Nadej Dubisson, she/her, Multnomah County Environmental Health.
Is Kathleen here? Yep, Kathleen.
Yes, hi, good morning, everyone. Kathleen Johnson. I use she/her pronouns. I'm with Washington County Environmental Health.
Great, thank you. Patricia?
Yeah, good morning. Patricia Kohlberg. I'm with Oregon Physicians for Social Responsibility.
Thank you. Ryan?
Ryan Ramage with...
Oh.
Ryan Ramage with Valley Environmental.
Thanks. That was it came in hot there, Ryan. Thank you. John?
Hey, John Bird here with Roseburg Forest Products.
Thank you. Beth?
Beth Ryder, Trinity Consultants.
Okay, I think I got all. Did I miss any Rulemaking Advisory Committee members?
Sorry, this is Charla Moffat.
Oh, yeah.
I joined late. Charla Moffat, OBI.
Welcome, Charlotte. Thank you. Anybody else that maybe joined after the order of operation there? Okay, great. Well, thank you. Let's move in. I switched the slides a little bit, but before we move into the conversation, I did want to bring up our group agreements, which will be important for today's discussion. Angela, the slides up. I'm just not seeing them for some reason. Okay. Well, I'll say a couple things about the group agreements as we lead into the conversation today. So first of all, this RAC by intention, right, really represents, and by design, right, is meant to represent multiple interest-based perspectives. And the hope is that the group agreements that you see on the screen are really meant to support the discussion that's best going to advise DEQ as the agency develops these rules. So as we go through our conversation today, part of my obligation and role here is to help hold us accountable to these. But I'll ask that we've really constructed a conversation, an agenda that really intentionally moves through the discussion. So we ask that you stay on topic, and we'll kind of formulaically move through a number of questions that we're seeking input for today. We'll ask that you really balance speaking time, and so we'll do our best to ask folks to both bring your perspectives in. But if you see yourself contributing more than others for today's conversation, just ask that we create room to make sure that we're hearing from folks around the table. I'll ask you to listen, to learn, and understand, and not simply to respond. Again, there's lots of interest-based perspectives. It is the expectation you're representing those interests emphatically, right, in this space, but doing so in a respectful, a candid, and a constructive way as we have this conversation. I'll ask you to address the issues and the questions. We've asked some very specific questions that we'll be seeking input on today. I'm going to ask you not to kind of address either people or organizations, or to critique or offer comment on folks' motivations, just acknowledging that there are interest-based perspectives in the room. And then finally, to the ability of this group, I always say it's a gift to the agency when groups like this can resolve and find common ground on any type of issue that comes out of this process, and we'll do so to the best of our ability. So I'll just ask folks, right, help me, help each other, help yourself, right, engage in this conversation in a productive and constructive way. So with that, let's keep moving. JR, I'm going to pass it to you for the agenda. Yep.
All right, thank you, Ben. So we'll start today's discussion with topics related to the implementation of the proposed rules as they relate to the CAO program. This is because the proposed updates to the risk-based concentrations, or RBCs, as part of this rulemaking will have the most significant impact on regulated air qualities in the state. This discussion will include DEQ's proposal for determining how and when sources will be required to assess risk using the new RBCs upon rule adoption by the Environmental Quality Commission. We will then turn to some specific items related to questions we received during meetings number 2 and 3 as to how DEQ will require reporting of specific pollutant emissions and how the agency will assess their risk. We'll then move to the fiscal discussion that will include specific questions the agency is required to address as part of this formal rulemaking process. We will also request feedback on the draft fiscal impact statement, as well as provide an opportunity for committee members to provide any additional information for the agency to consider related to potential fiscal and economic impacts. We will conclude RAC member discussions with the final roundtable discussion for the entire rulemaking. And finally, we'll open up the meeting to the public input before wrapping up for the next steps. We plan on a break between the implementation and fiscal sections, but we can adjust that based on the timing of our discussions. And with that, let's jump into the implementation discussions. So as we noted in our previous RAC meetings, this rulemaking is primarily focused on updates to the toxic air contaminant reporting list, the toxicity reference values, or TRVs, and the risk-based concentrations, or RBCs. We also noted that although the TRVs are used as standards by different programs within the air quality at DEQ, they are fundamental for establishing the RBCs, which provide the regulatory values used under the Cleaner Air Oregon program. This means that the implementation of the proposed RBCs under the Cleaner Air Oregon program has the greatest impact to regulated facilities and the public, and is the reason why we have provided time for these discussions today specific to implementation. One note before we jump in, RAC members are encouraged to provide relevant information during the implementation discussions, including fiscal and economic impact information. But I would just request that members hold off on any highly detailed fiscal discussions until that fiscal portion of the meeting later. So with that, let's turn to DEQ's proposal for rolling out the new RBCs and when sources would be required to use them when assessing risk at their facility. Next slide. All right. Yeah. So DEQ is proposing to provide two pathways. Oh, sorry, Angela. That was my bad. DEQ is proposing to provide two pathways for sources as to when they would be required to assess risk using the proposed RBCs upon rule adoption by the Environmental Quality Commission, or EQC. The first group would be sources that have not started a risk assessment prior to the rule adoption. These sources would be required to use the proposed RBCs at the time they are either called into the CAO program, this would be for existing sources, or when a new source applies for a permit. The second group would be sources that are either in the process of completing or have already completed a risk assessment under the CAO program at the time of rule adoption. In these cases, a source would be required to assess risk using the revised RBCs only if they propose to modify their permit or at the time of permit renewal, whichever comes first. The largest number of sources affected by this proposal are those currently existing sources that have not yet been called into the CAO program. Currently, this consists of over 300 permitted sources. So to provide some framework for those sources, DEQ is proposing to prioritize the call-in of those sources similar to the process during the initial rulemaking. DEQ will be following the same prioritization protocol that was used at the initial call-in of the sources during the original rule adoption. However, the RBC's emissions data and demographic considerations will be updated. Aside from using the proposed RBCs, we are proposing to use the most recent emissions information submitted for the 2023 air toxics emissions inventory. This will provide the most representative emissions data we have for these sources. We are also proposing to update the demographic information to include the following environmental justice considerations: percent people of color, percent low income, percent unemployed, percent disabled, percent with lower than a high school education, and then percent with children under 5. Prioritization of the call-ins for existing sources will provide these sources with an understanding of the order and potential timing of their call-ins so they can plan and budget appropriately for performing a risk assessment under the program. And finally, more of a clarifying item is that sources would not be required to use the proposed reporting requirements in these rules when submitting their 2026 air toxics emission inventories. Upon adoption of the rules, sources would not be required to use the proposed reporting list until 2029 air toxics emissions inventory reporting. With that, I would like to turn it over to Ben to facilitate the discussion on implementation of the proposed rules.
All right, thanks, JR. So if we go to the next slide, we'll look at the question that we'd love input on. So do you have information that the DEQ should consider related to the CAO implementation proposal that JR just provided some reflection on? So I'll open it up to RAC members for discussion. Yeah, Mary?
I think what I'm more information. So I have a question. So is this the appropriate time or should I wait?
Please.
So I understand the sensitivity around, facilities that feel like the new, adopting new standards or adopting new risk levels, for the folks that have already gone through this or other, I think there's been a lot of angst around, how that's going to reflect and what amount of work, facilities who've already gone through this are going to have to redo so my sense is that the implementation that you've presented reflects an awareness and sensitivity to the onerousness of the duplication of work. My question is there any scenario DEQ could envision where new risk values would make DEQ aware of a new and compelling risk from a facility where, based on this implementation schedule, you would not be able to address that risk?
Thanks, Mary. Chair,
Yeah.
are you tracking the question?
Yeah, let me say it back to you. So, Mary, thank you for the question. So, as I understand it, the question is, are there scenarios where we would not understand if there was, based on the adoption of the new RBCs, there would be a risk for a facility that was in that group that we're saying you don't have to use them, the new values, until you're renewed or until you do a permit mod. If there's a scenario in there where the risk is very high that we would not know about until the renewal or the modification, is that kind of the question? Like in the terms of like our proposed implementation plan?
Jim and Mary.
I'm actually more concerned with a scenario where you would know, but you don't have the ability to act because of the implementation rules that you've set out. Because my gut feel is that by the time DEQ has gone through a risk assessment with any given facility, you know it pretty well. And so you would know when a new value might, actually put it over a threshold or otherwise put it at risk. And I am more concerned about that scenario where you know and you can't act.
So it sounds like the question is that possible, right?
Right. Why you in an implementation schedule be a barrier for the agency to act on known risk in a community?
So great. Thank you for following up, Mary. So I'll say two things, and thank you for reminding me. This implementation proposal is not in rule. It is not part of proposed rule language updates, which is why we're having it separate here in the fiscal impact discussion meeting as well. We wanted to have this discussion because we feel that implementation itself is extremely important for the rollout of these rules. And so I want to make that clear first. The second piece is we have the authority in rule already to call in any existing source at any time to assess risk. So in the instance where, we do find that we would not be inhibited or prohibited from this proposed plan by calling a facility in if we've realized, oh my gosh, now this risk is above levels that we would need to be required to reduce, that they would be required to reduce by rule. So no, the answer is it would not inhibit us.
Good. Mary?
I'm sorry to take up some space here, but I just want to clarify. So when you say you have the authority to call in, does that mean you have the authority to call in facilities that have already gone through the program?
Yes.
Not just new facilities?
That's correct. Yeah.
Okay.
The authority is very broad. It also relates to unpermitted facilities. We can have unpermitted facilities as well perform a risk assessment.
Thank you so much for giving me the space for this.
No, thanks for asking the questions, Mary, and bringing the perspective in. Crystal?
Yeah, thank you so much for this discussion. And I also wanted to just thank everyone for all their work on this RAC thus far. Wondering if it's possible to have so having the authority and following up aren't always the same thing. So is there a way for us to include some criteria about like when DEQ would definitely follow up based on a calculation of increased risk? Just wondering how we would make sure to have kind of some accountability and certainty for folks going forward.
So, Jared, that might be I don't know if that's a question around what already exists. Otherwise, I think I can also interpret it as, Crystal, as a recommendation that DEQ should consider adding criteria that would define when you would take that additional action. But is there a clarification, Jared?
Yeah, I have a clarification, Crystal. Thank you for the comment. And when you say criteria, again, sort of going back to that piece where it's like when we find something, when we've have some information that shows that one of these facilities, so the prioritization will deal with, and to address Rob's comment in the chat, the prioritization will deal with all the facilities that have not yet been called in. That's what we'd be looking at. And what, Crystal, you're saying those facilities that in that group that we're not going to call in until renewal or permit mod, if there's something in there that the risk is high, is there criteria we could use to determine to say, actually, you know what, we need to call you in and have you on the prioritization list because it's really, your risk is high? Is that kind of the ask?
Yeah, I mean, I feel like there's many scenarios, and I'm just concerned about maybe some unintended consequences of just the complexity and the different scenarios. So we have folks that are coming in under the previous RBCs, and maybe they're good to go, and we don't necessarily want to call them up right after they went through permitting. But I'm also concerned about a scenario where maybe they got in under permitting, knowing that there was more protective RBCs, and that wouldn't be kind of as intended. So in that scenario, if it's a particular risk, I still think that those folks maybe should get another look based on the health risk, because the health risk doesn't care if we if our process was more onerous than we wanted it to be, or if it took longer than we intended. And just the fact that the rulemaking was so delayed makes me even more concerned about the ones that were that makes me more concerned about permits that came through during the time of this extensive delay in rulemaking. And I know we don't have a lot of resources in the state, but just want to be mindful of the fact that these rules, in theory, would have gone through already. And there's a lot of permits that, I mean, I don't know how many went through in the meantime, but just I'm really mindful that some might have gone through, and we should treat those with the same level of care from a health perspective. Thank you.
Right. Thanks, Crystal. So Ali, I see your hand up, so I want to bring you in, and then Crystal, that might be some follow-up that if you have the capacity to provide in written input, particularly if there's specific criteria that you advise or would ask DEQ to consider. Ali?
Yeah, thanks. I just want to sort of raise the point that the facilities that go through permitting, those get renewed every 5 years. So that renewal schedule exists. So it's not that they'll never be subject to the new standards. It's if they're in the midst of or have started it, they won't be, have to go back and reapply, but it would get evaluated. And so it's a matter of deferral of the 5 years. So I want to say, I don't know if that makes a difference in the way you're thinking about this, but I just want to put it out there.
Great. Thanks, Ali. Cassandra?
Yeah, to kind of follow up with Mary's question. So she's looking at more risk, but what if there's less risk and the facilities are potentially getting pollution control devices or limiting operations? So how would DEQ also address, maybe a greater risk, but also a less risk that's really costly to the facilities as well?
So I don't know, JR, again, I think this is both maybe a question and a comment simultaneously, right? So it sounds like
Yeah,
considering,
I guess I
yeah,
was a little confused to Ollie's point that, I think you guys had on the slide that there potentially be another round during the renewal process, which makes a lot more sense. But if there's an opportunity that DEQ would also potentially call in, especially a facility that has just gone through, maybe already got their addendum, already potentially on some timeline schedules. So if there's a greater risk, obviously there's going to be some less risks. And so where's DQ, and maybe also apologies, I don't remember her name that just previously was speaking to it, but also the criteria that works both ways, I guess. Like I was a little surprised by JR's comment that they would potentially call them in if they wanted to.
I think, yeah, well, JR, I'll let you speak for yourself. I
Sure.
think you were referencing the authority that DEQ had versus but we'll
Right.
jump in. JR,
Yeah,
speak.
no, thanks. And thank you, Cassandra. And just to sort of be clear, I think what we're talking about is a small subset of existing facilities. So I think right now we've got 38 facilities that we've called in. Now for new facilities, it's a larger class. It's over 40 or 50 that have been issued. And so I think your point is well taken, Cassandra. And I think what I'm hearing is that DEQ should do an analysis of all the facilities that have an approved risk assessment or are in the process of with the proposed RBCs to make sure that they're either not exceeding or going below those criteria. And honestly, we have the criteria already set up in our program. Cassandra, to your point, they are the risk action levels. And so, if they're below source permit level, a facility doesn't need any conditions from CAO, or if they're below a T layer or a T-back, they don't have to put controls on. And so in the instances where, one of those facilities, if DEQ were to do this analysis, showed either what I'm hearing from both Crystal and from you, Cassandra, is if DEQ needs to do that analysis, one, for showing if there's health risks that have been seeded, and two, to show that if the facility's risk has sort of diminished and gone below that, so that they can either, be called in to reassess risk, or they can, request us to do a risk assessment to reduce their risk. Is that kind of what I'm hearing? Cassandra,
I was mostly just trying to understand when Mary had proposed that potentially there's a greater risk and they've already gone through the process, and your answer was that we would call them in potentially again, and you had the authority to do so, and so to reassess. And so I was just asking, well, wouldn't that go both ways as well as if reduced risk?
Yes.
But no, I do think those timelines that you had proposed previously make a lot more sense to me than DEQ taking the time to go back and reassess when there's so many other facilities, to your point, JR, that hasn't gone through the process. And these individuals the facilities had already gone through the process. And I think there may be a greater risk kind of more down the road if DEQ is pausing the work currently. So the proposals of, the facilities that have already gone through to go through it during some sort of timeline at their next renewal makes, to me, a lot more sense. That initial proposal that you guys were making makes more sense than DEQ kind of working backwards. But I was just curious when you had mentioned that you would potentially could call facilities back into, just curious how you guys would deal with less risk. That's
Okay. Thanks, Cassandra. Jeff, and then come back to you, Crystal.
Thanks. Appreciate this implementation discussion. I think from my perspective, I was hoping to provide a comment around context. That right now, the way that the program has worked or not worked very well for the existing sources that have been called in, I think it speaks in favor of the implementation proposal or something like it. We intend to put written comments into the record to offer tweaks to the implementation proposal. But currently, of the 38 that have been called in that are existing sources, we're aware of 8 having completed the process and dozens that have been in the process for many, many years. And so currently the allocation of cost from this program has not been fairly distributed on existing sources, but neither has the allocation of the investment of time to determine whether other existing sources present risk. To the question of whether the new RBCs will cause certain source inventories to show up as presenting more risk, it's unavoidably the case that that's true. And that is not a feature necessarily of risk presented, but of the choices made in processes developing emission inventories. And so what happens is where you're facing the intensity of the high cost to refine emission estimates, often sources will look at RBCs and say, I can live with that one. I can live with an unrefined emission estimate because that estimate, when it's analyzed, does not drive assumed risk or hypothetical risk. And so you don't invest in source testing or scientific study or inquiry or level 4 risk assessment. You say, I've done enough to make certain that I can get through the Cleaner Air Oregon process. And so in this world where we've looked really, really, really hard at a couple dozen sources, but 90% of the sources have not yet been analyzed, in this world where the sources that have been looked at have been in this process for many years, in this world where those sources have been making choices to manage their costs and to provide some certainty through this process, I think the implementation proposal in the main makes a lot of sense. To the point that Mary was asking, I think that I wanted to say to you, JR, no, I don't believe that DEQ should adjust the implementation proposal for existing sources by reference to some brand new prioritization scheme. That totally undercuts the proposal itself. On the other hand, if you do know that there's a source that literally presents an acute risk at a curtailment level or better, that really is a concern to the community, then I do think that you have authority to address it, and probably ought to. But where you're talking about changes that could impact risk, could skew risk north based on inventories that have been in flight for many years, it would be inappropriate to reopen that, in my view.
Right. Thank you, Jeff. Crystal?
Yeah, thank you. So first, I wanted to circle back a question about reassessing every 5 years to see if it's known what approximate percentage of the permits are being reviewed on time every 5 years within that timeline. And then a follow-up additionally is that we all know that DEQ has not been well funded, and I would argue that in particular, DEQ has not been well funded, even within overall budget cuts and fiscal constraints. And so therefore, without calling in industries that represent a particular high risk, and in this environment of scarce funding, I would be concerned that ongoing new permits could prevent the industries representing a particularly high risk from ever being called in, if we didn't have a look back based on the actual emissions and associated risks presented from that.
Right. Thanks, Chris. I don't know if there's a response in the moment. Okay. Thanks for naming that, Crystal. Other considerations based on the implementation proposal that JR laid out that folks would want to bring in, Jeff?
Thank you, Ben. And very briefly, I should have said it when I was on fire a second ago.
Right.
I think we would hope that following the implementation discussion, DEQ would put the implementation mechanics into rule language proposed for consideration by the all stakeholders. But we'd like to see the implementation mechanics in rule.
Okay, thanks, Jeff. I think it was Patricia and then Beth.
Yeah, I don't know if this is the appropriate place, but I just want to emphasize or remind people that these entities have been externalizing their costs related to the public health and, loss of school days and work days and premature death. We don't have a good way of analyzing or knowing exactly what proportion of those costs that industry is responsible for, but it amounts to billions of dollars, in the state every year. And, industry has gotten a pass on those costs for decades. And I think we should just be mindful of that when we think about the cost structure now to them and how the state might even be able to recoup some of those costs, because it's partly the state that's paying for that, but it's also individuals, it's businesses through health insurance costs, it's everyone is shouldering those costs. So I just wanted to emphasize that.
Thanks, Patricia. So I think we'll capture it for now, but we can come back to that concept as part of the fiscal conversation as well. Beth, please.
Yeah, I know there's a lot of changes to TRVs, and when we look at facilities that have already gone through the Cleaner Air Oregon program, there's certainly specific pollutants that are driving the risk associated with the facility. I guess as we look into calling in facilities that have already been through the program, if there's maybe a mechanism where the facility could basically write a letter to say, this is not a set of pollutants that's really going to impact me, though I do emit it, and maybe write up a paragraph or a page or something to identify the fact that, yes, things have changed. It's not going to really impact the overall risk of my facility. So I am not going to redo this report. Hopefully that kind of streamlines part of that process to make things go faster within the agency. But just a possible caveat for discussion points, maybe.
Thank you, Beth. Any other, just open it up for folks if there's other considerations that DEQ should be holding as it's thinking about the implementation and the proposal that you all just heard. Yeah, Crystal.
Yeah, thank you. I just want to underscore the importance of this part of the process. If we don't have industries being reviewed in a timely manner for these risks, then it does take away from the intent of the program. And I think that we have the data knowing where the risk is, and that should continue to drive protections for health.
Yeah. Thank you, Crystal. Before we move to Mike, I'll do a last call for any other implementation comments. Okay, we'll also have a kind of final roundtable. So if there's things that come up, reflecting back to conversations that we've already had on the agenda, we'll have space for that as well. Mike, let's move to you.
Okay, next slide on fuel mixtures. And just to be clear, this first discussion is about vapors from liquid fuels, not exhaust from fuel combustion. We'll get to the diesel exhaust in a few minutes. So here are the fuels. We got diesel, the jet propulsion fuels, those are the JPs, and kerosene. And each of these fuels, there can be hundreds of different compounds making up a fuel. Generally, they're different hydrocarbon compounds of various sizes, ranging from a few carbon atoms, say, up in a molecule up to like 3 dozen. In general, it's best to have toxicity values based on exposure to the mixture. That way we account for all the additive effects from the different constituents or even synergistic effects, that is those effects that are worse than additive, or possibly antagonistic effects where the effect is actually less than additive. But we don't have good chronic data. So next slide, here's how we're proposing to do our evaluation. Let's start with chronic exposure. We're going to stick with our current practice of summing the risk from the individual components that make up a mixture. We think that we're getting the majority of the risk using this approach, that is by adding up the risk from the various pieces of the mixture. There is some uncertainty with so many different chemicals. We could be underestimating some risk. Still, until we get better data for the mixtures, we've decided on keeping this approach for chronic RBCs. For acute exposure, our proposal is to use TRVs based on exposure to mixtures. And again, because we have the toxicity data for mixtures, we think that's the best approach. Okay, that's it. So I'll now turn it over to Ben to facilitate any questions or discussion on these mixtures.
Great, thank you, Jeff.
Thank you, Ben and Mike. Sorry for my video. I'm wondering whether, Mike, you might say more about what you mean by what you just said to address potential risk for acute circumstances based on exposure for mixtures. The slides and the conversation just now leave me wanting to ask a lot of questions. Could you iterate that differently and perhaps with more detail?
Okay, I'll try if I wasn't clear initially. To best characterize the toxicity, the adverse effects from a mixture, it's best to test the mixture so that we take into account all the various aspects of that mixture. So if we have that information, and we do for some of these mixtures for acute, we think we should use that as the basis for developing the TRVs and using them for the RBCs. In the absence of that, those toxicity studies on a mixture, we're going to look at the components of the mixture and sum those up, sum the risk of using the RBCs, sum up the risk from the components. Is that helping?
It's beginning to. Thank you very much. I'm sorry to be involved at this stage. Not a toxicologist, but I'm just going to ask a question about the information you have on mixtures. Is that public? Is that available for review as part of this rulemaking? And do we have it?
Yeah, so yes, the information, the toxicity information is the basis for the TRVs, and all of that is part of the data set for the TRVs, all the references to that. So the various authoritative sources, and then you can find the studies on those. So yes, that is available information. That's I guess kind of the basis for this. It's a TRV update for the rulemaking, and that is all an open process.
Because this is a new way to propose fuel mixture implementation, do you have, or are you planning to, is DEQ planning to address this in rule, or is this just a heads up? This is how we'd like to consider acute risk going forward from fuel mixtures.
Let's see. Jay, I don't think we're
No,
including it in the
so
rule.
Jeff, I think your comment is taken, and if we did do this in rule, it would be through probably a footnote on the RBCs. I think we could address it there in rule.
Thanks, guys. And I'm not trying to stick on it. I'm just trying to understand it.
Yeah.
I'm wondering if there's a way that perhaps in a follow-on to the slides presented to the RAC for consideration at this meeting, if you could perhaps develop a slide or two with Mike to show an example of how this works.
We could even put out sort of like a one-pager info.
That'd be wonderful. Yeah, thank you. Appreciate it.
Yeah. So let's sorry, jump in.
Well, maybe add a little bit more, and I'm hoping I'm not confusing the issue now, but there is somewhat of an analogy for other groupings of chemicals that we have where we can look at it a couple of different ways. And I'm thinking of like the carcinogenic pHs. We can do those as a group of carcinogenic pHs, and we use an equivalency to do that, or we can add up the individual, look at the risk from each individual carcinogenic pH and sum those up. Do it one way or the other. Doing it both would double count. So that was our original intent in the 2018 rules. We weren't particularly clear about that, although that's the way we were implementing it. And I think we added footnotes to make it clear in the rule update in 2022 to say, yes, we don't intend to double count. This is how we intend to do that. It's not entirely the same thing. But I mean, I guess by analogy, a grouping of carcinogenic pHs is a mixture of individual pHs. So it's kind of okay.
Yeah, no, I know that this group has had the conversation, and DEQ has stated that its intent was not to double count. Jeff, I think hopefully you heard, and I think I'll just capture it for the record that DEQ can do a follow up in the form of potentially a one pager that can to help clarify with greater detail kind of what this looks like. Travis.
Yeah, I think Jeff pretty much covered what I was interested in. It was, excuse me, was an example. And if I remember right, I think that the basis for these was like 1980s Air Force Base exposure studies or something. Is that right? And maybe you can't answer that, and I just need to look into it more. But just I understand.
And maybe Dave can help with this. I think the studies, yeah, some of them might maybe from the 90s.
I think that's basically correct. Like these were acute studies, and it was exposure to the whole mixture of those. These are like the different fuel oil, like evaporative emissions from the different fuel oils, and so that's what Mike's talking about. These are TRVs that are based on studies where the subject was exposed to the whole mixture of evaporative emissions. Yeah,
and one of the things that I don't know, can't speak, intelligibly enough about is how those mixtures may have changed over time, and whether those older studies would be representative of the same materials now when I think a lot of the feedstocks and things are a little different than they used to be and may not have quite the same components. So, but I can't speak much more than that on it. So I think an example and an explanation of kind of where things come from would be helpful. Thank you.
All right, so we'll capture that as part of the consideration. Crystal, jump in.
Yeah, and just continuing with that conversation, I think if there were newer studies based on different components, it would be important, of course, for any regulated industries to disclose the exact mixture of their fuels promptly upon request during the permitting process. I also wanted to speak to the potential for double counting. So my understanding with this proposal is that for cancer and chronic non-cancer RBCs, we'd be using um, the component toxic air chemicals to assess the risks. But only for acute
Yeah.
non-cancer, we'd be using the mixtures. So to my mind, that wouldn't be double counting because it would be a different process. But while we're considering double counting, I do think it's worthy of pointing out that the original Cleaner Air Oregon program should have calculated cumulative risks in some capacity by having the spatial element so that folks could understand the risks increasing as various entities were clustered in different regions and how that cumulative risk might affect a given population. And so I think if we're asking or particularly emphasizing not looking at not double counting, I think we need to also elevate that we haven't fulfilled the original intent of the program by having that spatial element so that we could look at when these risks do overlap in a real way for communities.
Thank you, Crystal.
The
Yeah, jump in.
clarification, I didn't mean to imply that we would consider it double counting for chronic and acute. So we would look at an individual like chronic non-cancer and not double count that. But acute is separate. So it's perfectly, I think it's appropriate that we could have a different approach for looking at those different endpoints, cancer, chronic non-cancer, and acute non-cancer. We will look at those individually.
Yeah,
Thank
like
you.
I
That
appreciate
does
you.
seem appropriate.
Yeah, thanks, Crystal. Thanks for clarifying. Other comments on considerations for the assessment of risks from evaporative emissions? Again, we'll have a broader roundtable later if anything else comes up. Not seeing any hands, let's keep going.
Okay, so next topic here is diesel exhaust, and as a part of that, the diesel particulate matter. So, and I know this is an important topic here. So diesel exhaust being what's coming out of the stack after burning the diesel fuel. And similar to liquid diesel fuel, diesel exhaust is also it's a complex mixture of compounds. In fact, as a result of combustion, I would say it's even more complex of a mixture than the original liquid fuel. So we can lump the constituents of diesel exhaust into two main categories: diesel particulate matter, which is carbon particulates, I mean, soot basically, with absorbed hydrocarbons, generally is polycyclic aromatic hydrocarbons I was talking about, PAHs, and inorganics such as arsenic and cadmium. The other big piece is volatile organic compounds, VOCs, like formaldehyde, butadiene, benzene, and so on. We can measure diesel particulate matter. We can measure many of the important components of DPM, such as the carcinogenic pHs and the metals, and we can measure some of the many of the volatile organic compounds. So next slide, we'll talk about how we propose to evaluate the risk from exposure to diesel exhaust. So let's start with chronic risk. Again, we've got the two pieces of diesel exhaust, the diesel DPM, the diesel particulate matter, and the gaseous compounds of the VOCs. Our current process is to sum the risk from all the toxic air contaminants making up the diesel exhaust. But again, the best measure of total diesel exhaust exposure is DPM. So our current proposal is to use DPM as the surrogate for diesel exhaust exposure for chronic risk. And that would include both cancer and non-cancer, cancer generally being the more important endpoint as far as driving risk decisions. So next, let's look at acute risk. And here, if we had an acute TRV for DPM, that would be a good surrogate to use. But unlike the chronic effects, we don't have a DPM TRV for acute. So we're proposing to stay with the current process of evaluating risk as the sum of the components. And I'll now turn it back to Ben to facilitate any questions and discussion on diesel exhaust.
Great. Thanks, Mike. So again, information for DEQ that should consider related to how DEQ is proposing to assess risk from exposure to diesel exhaust. Yeah, Mary?
Yeah, might just be a clarification question. I think Crystal got to it a little bit, but I'm just curious, is this assessment of risk of diesel exhaust, since this is in the CAO program, is it identify, or is it the risk just associated with an individual facility's activity and or emission sources on diesel? I'm just curious.
For the RBCs that we're discussing, the RBCs apply on a facility-specific risk assessment basis. The TRVs for diesel particulate matter, as we mentioned several lifetimes ago, is that they also are used as the basis for the ambient benchmark concentrations used by the air toxics monitoring team when they look at that data and sort of look at the impacts, health effects of exposure across the state. So that would be where the other place where this would show up, and how we would maybe potentially assess the health risk there as well. We may apply the same logic to the TRVs at that point. We don't use RBCs in those assessments, though. Is that helpful?
Yeah, and I'm just suddenly realizing, like, I don't actually know, for example, with other toxics for like arsenic, how does DQ account for or include background?
When we're conducting risk, we're looking at risk due to the emissions from a facility. And so we're not taking into account background levels.
And this is reflected, Mary, in that the definitions are excess cancer risk and excess non-cancer risk. That excess is the implied above background.
Okay, thank you.
Thanks for clarifying, Mary. Other considerations from the approach for diesel exhaust? Yeah, Crystal.
Yeah, I mean, thank you. I don't think this is part of what we're discussing today, but I do just want to underscore that the background cancer risk is potentially a result of other emitters in the area. And so, if we have a set level of risk that we're accepting, it's per facility. And so folks that live in that area, work in that area, children go to school in that area, they're not gonna be able to live within the arbitrary confines of a single Cleaner Air Oregon allocated risk. They're gonna live within that region impacted by all the different permits, which do in reality add up to their individual risk. So I just want to underscore that as we consider how protective we're going to be, that we have this overall context of accepting this higher cumulative risk for these communities that live in the proximity to multiple emitters.
Yeah. Yeah, thanks, Crystal. I know you mentioned cumulative impact in your previous comment as well as something that maybe DEQ should be considering as it continues on the process. Mike, I'm wondering if or Patricia jump in, and then we have a couple other conversations around DPM. So, but Patricia, jump in.
Well, just to add to that last comment and to clarify, when you're assessing a facility, you're not looking at the mobile sources that are attached to that facility, the traffic that they generate due to normal operations. If they've got diesel trucks coming in and out of their facilities, that's all considered background. Is that correct? Even though it's actually generated by that facility? Do I have that correct?
Yeah, that is not included in the permitting of a facility typically. That would be regulated under the emission standards for those engines and regulated and would be considered mobile emissions. And this gets into a little bit more of like planning and planning and zoning decisions. But yes, they're not considered in the risk assessments.
Yeah. Thanks for asking the question. Clarification. Travis, jump in.
Yeah, I was just going to point out there are programs that DEQ has that cover this, and specifically the diesel will be covered under PM 2.5 and short-term NACS modeling that lots of facilities have to do and is proven to be a lot of work as well. So there are some programs that are out there that are covering this.
Great. So it's
maybe not exactly replica, but yeah.
Yeah. So Patricia, thanks for just naming it. JR for clarifying. Travis, I appreciate you naming some of the other programs, right? So we'll set the mobile stuff kind of off to the side because it's outside of the kind of purview of this discussion. But Mary, jump in.
Well, I just think it bears clarifying that the last comment around diesel being captured in PM 2.5 is a pretty inaccurate. That the ultrafine particulates and are well known to evade, sort of measurement under PM 2.5.
Thanks, Mary. Mike, do you want to? We have another section. Do you want to move through that, and then we'll open up for more discussion?
I think it's JR.
It's actually
Oh, it's JR. Sorry, I'm giving you extra work, Mike.
JR.
Like, wait, I'm not prepared for that. JR, jump in. Sorry.
All right. So next slide, Angela. Thanks. Thank you, Ben. And so in our previous REC meetings, the question of how DEQ will require diesel particulate matter, DPM, to be estimated, reported, and source tested was brought up. In this discussion, it was noted that DPM is composed of two distinct fractions. We'll call them filterable particulate matter, or FPM, and condensable particulate matter, or CPM. These two fractions are distinguished by how they are measured during sampling of diesel exhausts and are named quite accurately. The FPM is that fraction that gets impeded and collected on a filter that is in the sampling train. The EPA method for collecting particulate matter, known as EPA method 5, collects samples this way. And this method is for stationary source, source testing. The condensable, or the CPM, is the fraction that passes through the filter and condenses in containers that are held in a cooling environment such that the temperatures at the outlet of the sampling train is at 68 degrees Fahrenheit. This fraction is typically composed of much smaller particles that condense at ambient temperatures. Many toxic air contaminants classified as semi-volatile compounds present in diesel exhausts are captured in this fraction. This includes the highly carcinogenic polycyclic aromatic hydrocarbons, PAHs, that you'll hear about. An Oregon standard testing method, also called Method 5, Oregon Method 5, does include this back half of the sampling train to capture condensable particulate matter when testing for PM. And this is required at any source testing for PM, not just sources testing for diesel combustion. From source testing data that we have obtained thus far from the start of the program for testing for DPM, the testing from these diesel emergency generators shows roughly 50% of the mass of the DPM is composed of the condensable fraction. Next slide, please. So in reviewing the background toxicology studies used to develop the proposed TRVs for this rulemaking, it was determined that the chronic exposures to diesel exhaust in these studies were made at ambient temperatures, or approximately 70 to 72 degrees Fahrenheit. This makes sense as diesel exhaust generated at its source from an internal combustion engine can range from 300 to 800 degrees Fahrenheit, which are not suitable for inhalation exposure studies. At these temperatures, chemicals in the exhaust would form condensable particulate matter that would be captured on the filters used in the studies to determine the exposed rates, which means that the TRVs derived from these studies would be accounting for both the filterable and condensable particulate matter. As noted, the temperature that the Oregon Method 5 collects the condensable particulate is at 68 degrees Fahrenheit, and DEQ and OHA considered this a reasonable approximation for the ambient temperatures used in these studies. As we have observed through direct source testing, nearly 50% of the DPM observed using Oregon Method 5 is condensable particulate matter. DEQ is not proposing any changes to its current particulate matter sampling method to include CPM when estimating DPM for the purposes of human health risk assessments. This means that DEQ will require sources to continue to include both filterable and condensable particulate matter when estimating DPM emissions under the CAO program. And DEQ will require sources to use Oregon Method 5 when performing compliance testing to demonstrate their emissions of DPM remain under permitted limits. I'll now turn it back over to Ben for any questions on this topic or discussion.
Good, thanks, JR. So same set of questions right around what DEQ should consider in terms of the proposed methodology for estimating and monitoring DPM. Again, open it up for comment, questions. Yeah, Beth?
Thanks. I just kind of want to talk about the test method for showing compliance or demonstrating compliance. The Oregon Method 5 has been used for a long time for stationary sources. And so I think it's well established within the state that that's what folks are using for particulate matter determination. But EPA and all their methods for engines specifically look at method 1065, which is a dilution method. So I guess we don't want to get too technical. So I think it would be great if we could look into why EPA would use one test method versus the test method being presented here. So 1065 or 1039 versus method 5.
Good. Thanks, Beth. Other comments on the proposed approach?
Actually, sorry, can I add to what I just said too?
Yeah, of course you can.
I think it's also helpful to think about for method 1065. It is a dilution method. And so therefore it's introducing ambient air into the test method. And so it would be very representative of how the engine is interacting with the current environment. And as a side note, as we go towards more stringent requirements for diesel particulate matter, oftentimes the diesel particulate matter the diesel particulate matter filter sometimes is also paired with an SCR. SCR is selective catalytic reduction. It's not really relevant for the toxic pollution program, but these control technologies are paired together and part of other programs within Oregon. Or might be used for other programs. So when you use an SCR, it uses ammonia, and the ammonia can cause artifacts for method 5 and 202. So it would overrepresent the actual total particulate matter that's coming out of the exhaust. So kind of as we're moving to more control technologies within the state for these engines, it's important to consider how that's impacting the overall test methods.
All right. Thank you, Beth. Crystal?
Yeah, I think considering 1065 versus Method 5, I think they serve different purposes. Method 5 is, I believe, more important for the slow, steady emissions from stationary sources. And 1065 is more about mobile sources. And I think if we're going to have that kind of discussion, we need to really consider what we're measuring and also have those things addressed for what they're for. I also think that the ATSAC process has already considered what the technical elements should be. And so I think that their expertise should also be honored.
Right. Thanks, Crystal. Beth, did you want to respond, and then Ali, I'll bring in.
Just quickly respond to the mobile source. You are correct. It was originally intended as a mobile source test method, but is also used in EPA for testing stationary engines because engines do have quite a bit of variability in their load.
Okay. Thank you. And again, these are all meant to be comments for DEQ to consider. So I appreciate you bringing the context, the recommendation, the consideration for DEQ. Ali, jump in.
Yeah, thanks. Beth, do you know if that's the same test method they're using for engine certification programs, or is it a different test method? So and if you can provide us some information about how the test results from that method compared to method 5, if that information is available, it would be very helpful for us to get. Thank you.
Yes.
Yeah, you got some homework, Beth. It sounds like. Thanks, Ali, for the ask. Any other comments on considerations for this approach? I'm not seeing any, but I'll be patient. Okay, well, wait, let's go to the next slide, Angela. So we're going to create some space, and certainly, love to invite as broad of contributions as we can. This is kind of the closing slide before we'll take a break and transition kind of magically into a fiscal advisory committee as we move into the fiscal conversation after this. But to kind of wrap up this morning's first part of this conversation today, we wanted to just open it up for a roundtable around implementation broadly. So certainly we've heard from a number of you. If you want to reiterate some points or if there's new things that have come up for you, that's great. Also, would just love to invite folks who we haven't heard from to contribute any high-level thoughts, reflections, or additional considerations. So with all that as a preface, I'll ask for those who have already contributed just to take a few breaths. I'll invite folks in. If we haven't heard from you, if you have any kind of closing thoughts or reflections from the implementation discussion, and then I'll just open it up more broadly. Charla, it looked like you were trying to come off mute, but on camera. There you are, Charla.
Thanks. I didn't even have to raise my hand. Thank you, Ben. I was just, it wasn't clear to me the total number of toxic air contaminants being changed in this rulemaking at all.
So JR question, the total number of contaminants being changed or just values?
Off the top of my head, I need to go back and look. So we'll stay tuned. We'll get that information to you. We can have somebody verify that right now.
So currently in the inventory, it's 633.
In the current, like what folks have to assess right now or report on right now, because there's the reporting list, which is the larger list, and then there's the regulatory values or RVCs used in the program, which I believe is around 250 or 260 currently. But I've got folks that are checking in and are providing. Let me see. The total is this. And I'm going to pause and I'll get back to you on that total number. I don't want to make a mistake.
So
here,
both total numbers, what it's going from and what it's going to, would be really helpful just in the big picture. Thank you.
Thanks, Charla. Okay, we got our crack team of folks at DEQ. I'm sure doing some background work, so we'll bring that back in, JR, when you have that information. Other thoughts, again, just inviting folks we haven't heard from. I'd love to start with you all, and if we don't see any hands or folks coming on screen or off mute, I'll just invite any final thoughts from the rest of the group. try to count to 10 seconds when I ask that. It feels like a long time when we're on a Zoom meeting, but let's just open it up. So thanks for the grace for anyone who's been patient. But any final thoughts on implementation or reflection, Mary?
Yeah, thank you. For me, my initial questions about implementation in regards to DEQ's, ability to again act on, compelling risk is what I'm really looking for in this program. And so while I appreciate the challenges of the development of a program and the practicability of that, it does not feel like a program that is truly going to serve communities and protect public health should be defined by implementation as much as the intention under the risk as we can assess it, and that the communities themselves need to have the transparency and the information as well. So I just want to caution, and we'll look deeper into the implementation ideas that DEQ's presented. But, that is just our intention, is to make sure that it doesn't get in the way of the intention of the program. And I'm a little bit concerned at some of the things that I've heard in the conversation today around practicability being an overriding consideration above risk.
Yeah, thanks, Mary. And again, like just reflecting, because I know we'll go into some of this conversation as we get into the fiscal, but we're really this is intentionally designed to bring the multiple perspectives in. So appreciate you sharing that, Mary. And I think there'll probably be some other thoughts and comments that are shared in the next section that may reflect some of those same experiences or feelings. Any other final thoughts from folks? Yeah, Jeff, jump in.
I guess I wanted to react and say that while I appreciate DEQ attempting to think through the implementation approach for existing standards, I feel that the agency's evaluation of the impact of this program on industry and on the state of Oregon has been undernourished and not yet really well understood. The magnificent number of changes being proposed have not been, I think, well understood in terms of the ability to roll this out. And I do believe that it's important for the state of Oregon to have an effective and practical program that's being implemented. Currently, while we have taken perhaps approximately 8 facilities through the risk assessment process in the state, fully 5 sources have fully closed or nearly fully closed in the same time frame, meaning that because of regulatory burdens presented in the state, that was either entirely the result of their closure or partly the result of their closure. And unfortunately, what we're not doing in any of these instances is considering what effects that might have, what health effects that might have. Those types of, where operations close not because of compelling risk reasons, but because the burden of the program is too great to assess whether they have such risks. I think we need to be more practical, and I do think we need to be more refined in our approach. And I'll leave it there.
Yeah, thanks, Jeff. And again, I'll just reiterate, we will be hearing interest-based perspectives, so I think we can come back to that as well in the fiscal. But the question has been on the table the whole time: what should DEQ be considering as it thinks about implementation, as it thinks about the rules? And so I really do continue to invite folks in to share those interest-based perspectives. I'll leave you. Let's bring you in then, Crystal. I'll come to you.
Thank you. I appreciate it, Crystal, if I jump in here. Jeff, if you can elaborate a little more on what you're saying about our DEQ's blind spot towards the impact of this, because that's what we're trying to cover here. So if you have specific input, I think it'd be good to surface for us. Again, I understand
Ali,
that.
hold on, Jeff. Ali, finish, and then just beyond like regulatory burden, Ali.
Yeah, I think again, in terms of implementation, our objective here is recognizing that the rules require and the science requires us to update the TRVs, and that's what we're doing. Bringing science into the program, trying to deal with the risk that the program is designed to deal with in this, and we're trying to make sure that while we're doing that, we're not suddenly changing goalposts for the facilities that are going through this. So that was our attempt to managing that the transition, and how to again also making sure that we're addressing the risk that may be coming. It is the primary purpose of the rule. So we're balancing this. I hear you about the cost impact of facility closures. I don't accept that the 5 facility closed that as a result of a CAO. There were a number of other reasons that are out there. I think it's sort of we can all point to. It's easy to say the CAO caused the closure, and I got to respectfully push back and say, and if you have, we'll be talking about the cost and the fiscal impact is next. We'd love to hear what is the sort of what is the impact that we need to consider here, and so how can we mitigate the cost. The other point is around the timing that it takes, and I hear that. We built in the previous rule a lot of accommodation for facilities to be able to ask for extensions. And I think it goes both ways, both our resources at DEQ and the facility trying to provide us with the information. Do we need to revisit some of that in terms of our timing to say, okay, here's you don't get to redo your emissions inventory 5 times. You submit to us once, and we do that. So those are the types of things that we could consider, and I'm open to hearing from everybody, especially those who've gone through this process or going through the process. And your firm has chaperoned people going through the process, so it's of huge interest for us. But I think it's if you can bring us specifics and recommendations, that would be great. Thank you.
So just before I go to you, Crystal, so Jeff, that might be right now, that might be a written comment. I mean, certainly I think we've heard some comments around practical implementation, around the regulatory burden, around the cost, around the timing, around capacity, around health risks, around the externalized cost to health impacts, right? So I think y'all have named some things that you're asking DEQ to consider. But Jeff, just because Ali just came in, I'd love to just give you a moment if you want to reply now, or that might be in writing, and then Crystal, I'll come back to you.
Thank you. And thank you, Ali, for the question. I think that the from my vantage, the largest problem with the program's implementation to date has been its complete lack of certainty and predictability for the regulated community going through it. And where sources have requested extension, it's often because they're facing a really challenging choice: either accept a extraordinarily conservative emission estimate, or try to figure out how to prove the negative that emission doesn't exist. And so I think from my vantage, where we could perhaps learn to improve the implementation of the program would be in identifying reasonable judgment calls and using reasonable judgment calls that don't necessarily overestimate risk. In most instances where we've deployed very expensive source testing or scientific study to evaluate some of these estimates, to evaluate the conservative assumptions that otherwise would need to be made, we found that the conservative assumptions really were not accurate. We haven't typically found in these tests, wow, it's more than we thought. And so that's something that I would offer as perhaps a way that we could get through this a little easier. I did not intend to indicate that the source is closed because of Clean Air Oregon's applicability to them, but in certain cases, they did name those regulatory burdens on their way to closing. And I can report that businesses looking to invest or not in Oregon are concerned about the possibility that they would go through Clean Air Oregon due to its unpredictable nature. And I do fear that the significant number of changes being made to RBCs will further complicate that. Thanks, Ben. I'll leave it there.
Yeah, thanks, Jeff, for responding. Crystal, please jump in.
Yeah, I just wanted to express my agreement with Jeff that we have clearly a lengthy process of these permits going through DEQ, and I really want to emphasize the importance of fully funding the Cleaner Air Oregon program so that the permits can all be reviewed in a timely manner, reflective of their importance to protecting the health of communities.
Thank you, Crystal. Any other thoughts on implementation? Really appreciate the way y'all are navigating this conversation. Thank you. Any additional thoughts? Okay. Not seeing any hands or new unmutes. I'm going to suggest we take a break. It's 10:26. If we could take 10 minutes, we'll come back at, let's do my math, 10:36. And we're going to move into, when we come back, into the fiscal impact discussion. So we'll move through that. We'll have a final roundtable. So for kind of wrapping up this process, and then we'll open up for public input towards the end of the meeting. So let's come back at 10:36. See you in 10 minutes. I'd like to welcome folks back. So hopefully folks are here. We're going to move into the fiscal impact statement discussion. We have kind of several prepared slides with specific questions required for consideration, and then we'll have a broader roundtable. But JR, are you kicking us off?
Yeah, Ben, so before we jump into that, to address Charla, your question here, and thanks, Angela. Yeah, sadly, it is pretty complicated because of groupings and other sort of ways that we're accounting for these chemicals. But I did want to try to give you as best a summary as we can. So for the reporting list or the priority list, that list expanded from 606 to 650 tax. We added 95 total. 92 of those have new TRVs. That's why they were added. There's only 3 that were added that don't have TRVs. And then the math gets a little in the weeds because some of those previous ones that were groups are now separate, and some that were separate are now groups. So just wanting to let you know that the absolute number on the reporting list went from 606 to 650. And then if you can go to the next slide, Angela. So there is a total of 377 proposed TRVs, toxic air contaminants that require that have TRVs and are regulated under the CAO program. And here's a pie chart. So 47% of the total TRVs that are in these new proposed rules, they are the same as the 2018. 21% of those we propose changes to, and then 32% are just new TRVs. So hopefully that is a helpful breakdown, and I can share this with you and all the RAC members. I believe this is we have a slide similar to this in our meeting 1 slides.
Great. Thanks, JR.
Yeah.
Any follow-up, Charlotte, or is that you got the information?
Yeah, if they can send those around or post them or something, that would be great.
All right. Good. Nice job, team. Okay. Let's move back then. We'll go back to the future here for the fiscal impact statement discussion. JR, are you going to lead that?
Yes. So, and thank you, Ben. Thank you, Angela, for getting the decks moved around and accommodating that last minute slide deck. Okay, so yeah, welcome back, everybody. Let's jump into the fiscal discussion. So ahead of this meeting, we provided the draft fiscal impact statement for your review. As noted in the fiscal impact statement, DEQ is not proposing any new or revised program fees for this rulemaking. The primary way in which permitted sources could experience direct fiscal impacts is if the proposed RBCs affect the outcome of their risk assessments. That is, if the new RBCs cause risk to increase, a source could be required to meet higher levels of risk reductions under the program, which could lead to increased CAO program fees, as well as increased cost required for consulting, engineering, and/or installation of controls. Similarly, if the proposed RBCs lead to decreased risk outcomes for a source, this could reduce these same fees and costs. Additionally, the proposed updates to allowing sources to adjust exposure assumptions in specific instances without requiring a level 4 risk assessment could potentially save some sources a significant amount on program and consulting fees. Finally, in the draft fiscal impact statement, we present some information on the economic benefit to reducing exposure levels of the public to toxic air contaminant emissions. In addition to these items, there are several required discussion items for the committee. And I'll turn this, next slide, please. So on this slide are the required recommendations that DEQ must seek under Oregon revised statutes. And on the next slide, we have these listed in as questions for the discussion. So I will now turn it over to Ben for that discussion.
Right, thanks, JR. So folks can, actually, Angela, if you just want to sit on the previous slide for a second. So these are the requirements per ORS 183.333. So I'll just let folks digest that. The extent of impact, because our question is going to align very specifically with this. If we go to the next slide, then. So for discussion, explicitly, and maybe we'll just move one question at a time to keep it synced up and make sure that we're meeting the obligation to ask these questions and to get input. First question, would the proposed rule have a fiscal impact? So I'll just open it up for comments and reflections. Yeah, Charlotte, please.
So, yes, they will. I don't know if you want me to go into number two, if you want to
Yeah,
take
you
this
might
one.
as well. I was like, they kind of fit with each other. So if you want, if the answer is yes, describing the extent, and let's come back to the small businesses. But if you want to hit on it, that's fine. We'll ask that question explicitly.
Yeah. So I'm going to open it up with just something that's slightly off topic here, but I don't know whether others saw this, but in the Governor's Prosperity Council's recommendations that were released late last week, there was a recommendation. It says the governor should direct the DEQ to pause the Cleaner Air Oregon toxic air contaminant rule and update rulemaking to allow for more rigorous scientific review, direct DEQ program staff to focus on timely implementation of covered facilities and processing new permits. So that's just kind of the backdrop against all of this is happening, this rulemaking moving forward. But secondly, I think it's important to mention that while there aren't fee increases associated with this rulemaking, they are very much being contemplated. I mean, DEQ has stated its intent to increase CAO fees. I'm not sure how much those are going to be. The last time we saw a significant fee increase in air quality, it was an 83% fee increase to the Title V permitting program. And since then, we've actually seen a decrease. So the increase in the 83% increase in 2023 was implemented, and actually the number of Title V permits that are current at this time has actually decreased. So of the right around 100 Title V sources, only 37% of Title V permits are actually current right now. I just thought, that is another kind of piece of background information. So if we go to looking at the fiscal impact statement itself, one of the things that DEQ says here is that there was a very rigorous fiscal impact evaluated in the 2018 rulemaking, which was the original rule. And because that was rigorous, they're letting that stand. And so I don't know any government entity, private entity for whom costs have not increased since 2018. I mean, that's 8 years later. We're almost a decade later, and we've seen very significant increases in all kinds of different products and services just in the last 2 or 3 years. So I think that's really out of date and probably not a great starting place for the fiscal impact statement. So the other thing is, if we look at something that's included here, looking at for example, the level 3 risk assessment, and we've got a range here of 6,800 to 137,000. That is pretty far off, and we'll be, providing some comments on that. I think that I talked to a number of consultants about this, and I think that those fees look like up for a level 3 risk assessment are probably start in the $35,000 to $40,000 range and go up to maybe, approaching $200,000. So that is very different. So presumably, if you've got that kind of a disparity in the level 3 risk assessment, um, probably level 4 needs some attention as well. And then I believe there's a section in here on source testing. And DEQ initially said that facilities would not necessarily have to source test. Well, I suppose that is true, but if a facility has an issue with the emission factors that DEQ is requiring them to use, then they pretty much have to do source testing. So it's a little bit of a false choice. So they're basically, if there's going to be risk from the emission factors that DEQ has, and they have to do source testing, that kind of starts. I haven't seen, the consultants I've talked to, we haven't seen source tests that are less than $50,000. And I think they were significantly less in this document. But the point is that really, far more facilities, they're not just doing this to like get better information. They're being put in a position of you either accept DEQ's emission factors or you do source testing, which is quite expensive. And I know of at least, I guess it doesn't meet the definition of this quote small business because they're not under 50, but a company that's between 50 and 100 employees is still very different than, very large companies with, international, facilities around the globe. We're talking about very different kinds of businesses here. And those there was source testing involved in that circumstance. So we'll, put this in writing, but in our comments, but I just wanted to raise that. Thank you so much.
Yeah, thanks, Charlotte. Thanks for landing where you did. I think probably providing in writing the extent to which, whether it's cost escalation or source testing costs, et cetera, can be captured more accurately. Please submit that in writing.
Ben,
Yeah,
thanks,
JR.
Charlotte. I just wanted to chime in. Thank you. Please, yes, submit all of that. I just want to make one friendly amendment. The prices in the tables that were taken from the original 2018 were adjusted using the producer price index for engineering services. So they were adjusted, and I believe most of those went up 30%, 34% for both the consulting service fees and for the installation of projects. Just to be clear on that one.
So maybe, Charlotte, I'll just ask that you double check maybe with what JR just said and cross-reference that with what you're hearing in the field as part of written comment. But did you want to follow up?
I was just going to say, well, then they're off even more. But anyway, yeah, we'll follow up on that. Thank you.
Okay, thank you. I think Travis, Mary, I saw a hand and then it went down, but now you're back. Travis,
I
first.
don't have much to say other than
Okay.
I can confirm that from the consulting side that what Charlotte's saying is true, that level 3 is, significantly more expensive, and source testing, don't know of a source test that's you can get done for $6,862. You can't get a tester to show up, for than 4 hours for that price, That's all I wanted to add.
Yep. Okay. Thank you. Appreciate it, Travis. Mary?
Yeah, thank you. I always feel like the proposal having a fiscal impact, this is a mandatory sort of perfunctory question that gets asked around all rulemaking. And I think as a community member, I continue to feel like we need to identify that the benefit cost analysis is missing. Fiscal impact is I don't think should be narrowly defined. Without a real understanding of the benefit to communities. I also think, a lot of these facilities are in communities and neighborhoods, and I suspect that, a more robust and transparent regulatory system where communities can have more confidence and ease anxiety and concerns might have a really incredibly beneficial impact, not only on public health and the cost of that, but also on just the ongoing value of neighborhoods and living in a community where they know that the industrial facilities, of which many do exist in close proximity to neighborhoods and schools and other things, as long as they're well regulated, can actually, I think, be a really potent benefit to a community, and not a concern regarding, the value of homes and others. I would also say I was really fascinated that last fall, towards the end of the year, John Taponia, who's now with Oregon Business Council, did a presentation around some of the headwinds and issues that we have. And I think this was done in advance of the Prosperity Council that Charla evoked and brought up. So her comment made me think back to the presentation that he had given, where he actually did talk about, some of the significant headwinds that we're facing. And yet, honestly, in the detail of his presentation in a study, and it's, later, it's about the 58th minute of his presentation, he specifically looks at the regulatory loads that Oregon, that exist in Oregon. And while he does acknowledge them, and I'm not, I don't want to not, acknowledge that there is in some businesses regulatory loads. It doesn't appear, considering that in the primary metal manufacturing, the wood product manufacturing, computer and electronic product manufacturing, some of the ones that I know that are probably most addressed and captured in the CAO program, the load is not actually particularly, the regulatory load is not particularly heavy. And so I just want to make sure that when we are talking about the real cost, that we're being specific to the actual experience of this program on businesses. Because I've talked to many of the businesses that have gone through CAO. Obviously, Jeff talks to many of them, different context. And I have had some that have said, that it has been not a problem. In fact, I've worked with some businesses that have sort of voluntarily gotten ahead and done their own CAO risk analysis, just to save themselves the problem of waiting until DEQ imposes it on them so that there are no surprises. And it doesn't feel like it's, so I'm not saying I understand all businesses' experiences. I just want to make sure that when industry and business are bringing their comments to, so that we can better understand how this program does fall and how it affects them, that they're being honest. And I'm just suggesting that maybe the data broadly doesn't support the anecdotal data in any more than my anecdotal experience with one industry partner who's saying this wasn't particularly difficult is reflective of the whole industry experience. So I just want to flag that I have seen some data that would actually suggest that it isn't possibly particularly the AIR program, particularly the CAO program that is causing the regulatory burden for businesses in Oregon. And I would suggest that we should maintain our stringent commitment to protecting communities, and AIR programs really do that very well. So thank you.
All right, so I'm going to pause. So Mary, I'll pick up the piece where you started around really capturing kind of the benefit costs effectively as part of the analysis. What I'm going to ask is that we don't get in a debate from different perspectives around the regulatory burden and how either industry or community is describing that. Charlotte, I saw your hand and Travis's hand come up. So if you want to offer a comment, that's fine. But what I don't want to do is kind of go down a path of trying to say whose story is accurate, right? If that's okay. Charlotte, jump in.
I appreciate that, Ben. Well, to start with, we are not talking about industrial facilities not being good neighbors. That is not the issue here. But there are different programs, different air toxics programs in other states that are not as burdensome. There are, off ramps, and we're talking about evaluating really, the high risk subset. And that is not what the Oregon program does. So we're not talking about not being good neighbors, not being concerned. Those are very much things that are important to the businesses, and they want to be good stewards in the communities in which they operate. I appreciate Ben's comment about, yeah, the interpretation and sort of, questioning, the honesty of what people are presenting. I don't come to these things just throwing around wild, accusations or whatever, so I really don't appreciate that. And so, anyway, I think that, we evaluate what we see and what we hear from our members, and that Oregon is not a particularly regulatory. We have a lot of regulatory exceptionalism in this state, and it doesn't apply just to DEQ. It is beyond DEQ. But what everyone has to know is these companies aren't just dealing with DEQ's regulations. They are dealing with, across the board, every, regulated regulation being implemented by a state agency. And I would just also say, perhaps, Mary was talking to new sources rather than existing sources. That's going to be, and I don't need to get into a debate about that, but I'm just saying those are very different conversations than, whether it's a new or existing source as to whether or not that they feel that was a challenging process. It probably has to do with what they manufacture, for example, because there's a lot of variation in what these facilities manufacture. So I'll just leave it there. Thank you.
All right, thank you, Charlotte. So I'm going to try to bring us back into this conversation. So I appreciate some of the context that folks are trying to bring in. This is not the Prosperity Council. We're not having a debate around kind of what they put out or what they put forward, nor is this is an Oregon-centric conversation. So the comparison and context for other states, valuable in its context, but if I could again just bring folks into this discussion around the fiscal impact. Crystal, jump in, and then I'm going to ask the third question really specifically around kind of small business. But Crystal, jump in, please.
Yeah, thank you. So this is a difficult issue because theoretically we are looking at a total cost to industry and business compared to the cost saved. And so when the government protects human lives, the return on investment is more than 70-fold for some types of pollutants. For example, PM 2.5 is about a 70-fold return on investment. And so while the information presented in the fiscal statement is really detailed and well done, I'm not seeing an exact like apples to apples of like this much invested versus this much saved. But we all know that air pollution shortens lives. No one is disputing that fact. And so for me, the question comes down to how much is each life worth? And I think previously, for example, our federal government put it at upwards of $10 million for the cost of a life. And so I'm interested in what we would put it at. Would it be $10 million? Would it be $1 million? Would it be $50,000? And are some lives worth more than others? And I think given that the current federal administration has put the value of a human life at zero, I think Oregon should really continue to support a state-based program like Cleaner Air Oregon that does value human life, instead of just bowing to these tired asks for more deregulation. I think Oregon is exceptional in our regulations, and that's a good thing, especially in the federal environment that we find ourselves in. And considering costs, communities are also squeezed by costs at the household level, cost for food, housing, and also medicine, the cost of cancer treatment, the cost of living on one less income when a family member dies, or supporting a child's full potential living with a disability. So I just want to point out, we're looking at these dollars and we're trying to balance our needs, but these costs represent the cost of a life and the cost of all the associated impacts. Thank you.
Thanks, Crystal. So some of that may be helpful in a written comment, particularly around some of the cost analysis and how you calculate that. Patricia, maybe I'll bring you in. I know you had named externalized cost earlier in the conversation, so please feel free to add or bring in some additional contribution. Jump in.
Well, I just wanted to add from a public health perspective some information about a study that came out from the Harvard School of Public Health just a couple years ago about the worldwide global burden of premature mortality from specifically diesel exhaust. And their estimate was that every year globally, fully 20% of the deaths could be attributed to diesel exhaust. And I'm not arguing that that 20% is what we have in Oregon. I just want to make people aware of that. This was a very well-designed study, but I think it highlights the particular importance and the particular magnitude of diesel exhaust in our communities in terms of its impact, its potential impact, not just on human suffering, but the dollars and the premature death. And I just think that's something that we need to take seriously, as diesel exhaust as being one of the most potent and important pollutants in our community.
All right. Thank you, Patricia. I want to move us to the third piece, and we're going to drill in a little bit deeper shortly on this as well. But would the proposed rule have a significant impact on small businesses? And I think, Charlotte, you had referenced this is the small business definition of 50 employees or less. And I'll just acknowledge you talked about kind of that spectrum where you have 50 to 100 that might still be impacted but don't qualify under the definition. Jump in, Charlotte.
Right. I was just going to say that I don't know that we have seen an example of a small business go through the program. Certainly, anytime. I mean, if we're talking about things being burdensome for large businesses, they are definitely going to be much more challenging for smaller businesses. But there's certainly, is a facility that has been going through the program, and they are not under 50 employees, as I noted, but they are still not a large business by any stretch of the imagination. The cost of their level 3 risk assessment was nearly $700,000. So it's still quite a small business by any definition. We have a little bit of a different, I think there's the federal definition is, I think, 100 employees. So they would meet the federal definition, but not our state definition.
Okay. Well, maybe we'll come back to some thoughts around that in the next part of the conversation. Jeff?
Thanks, Ben. And listening, it's a really challenging conversation. I think Mary's correct that most of my information is anecdotal rather than some sort of survey of impacts statewide. But anecdotally, we have represented the vast majority of existing sources called into this program and have been participating in discussions about this program's reach. And I think that those discussions inform me that this will have a significant impact on any small business that's called in, Ben. That specifically, what ends up happening is sources end up spending a great deal of money to defend their current asset, to prove the negative, that they don't present the compelling risks that that we all want to avoid. To Charlotte's point about being good neighbors, but that's not what we've seen so far from existing sources going through this program. We're not seeing those compelling risks. What we're seeing is significant amounts of money spent to protect current investments in the state, which discourages those businesses from making specific additional investment in state. And I don't believe that the near 7-figure type or beyond expenditures that folks are making to get through emission inventories that would show risk is below TBAC levels, for example, are the types of expenses that could be borne by small businesses. Any more than I think a small business could have borne the expense of engaging toxicologists to review the hundreds of changes that were proposed in this rulemaking. Deb Proctor has significant written comments on the way to continue a conversation that she's been having with the ADSEC and DEQ and OHA. And I would say to you directly that wasn't funded by small businesses in our communities. So this program is challenging because it's well-intentioned and it's aimed at things that are important to protect against, but it's currently costing quite a bit of money and discouraging, anecdotally, businesses from being here. And there are effects to our health, on our public health, from businesses that either can't operate here or choose not to. And those also have not been addressed in this fiscal impact statement. So to me, I think the answer is undoubtedly true, that the proposed rule would have a significant impact on small businesses, even if it's taken as true, every cost that DEQ has enumerated in its own fiscal impact statement. For example, if a small business had to install a fabric filter, that cost, according to the DEQ, could range from $400,000 to $21 million, depending on the source. That is an incredible cost on a small business. So I think we need to move from, is it going to have a significant impact on a small business, to what can we do to reduce that impact, Ben?
Yeah, and we're going to like previewing the conversation we're going to have here momentarily, Jeff. Mary, jump in.
Yeah, thank you. I just want to remind folks the genesis, and remind that the chaos and disruption that was created by the discovery of toxics in neighborhoods that preceded the development of Clean Air Oregon was incredibly disruptive to, I don't know Bullseye Glass. I think they can have anywhere from 50 to 100 employees. I'm not sure what their standard workforce is, so whether they would be defined as small business, but I really think the size of the business is probably predictably less likely to be small, but not necessarily, because we are talking about, that the risk is the driver here. But I just also remember there were quite a few businesses that came and did a lot of input to the development of the Clean Air Oregon program in order to avoid the crisis that was created ahead of this. And so the idea is that we're getting ahead of this. We're making risk more easily identifiable, more implementable for a plan to address it. And I just think that it should be acknowledged that this is really intended to manage risk in a way that is more predictable and does not create the crises that we saw in our communities ahead of the establishment of it.
Thanks, Mary. So I'm going to go Crystal and then Charlotte. And I do want to move us into another part of the conversation. Like I appreciate folks providing context. I do want to center in on this obligation that DEQ has to kind of have a facilitated discussion around the fiscal impact. So Crystal, go where you're going to go. Charlotte, go where you're going to go. And then I'm going to introduce us into another set of questions specifically around kind of mitigations and opportunities around small business. Crystal, jump in.
Yeah, thank you. So based on my understanding of the process, DEQ's assessed risk is well documented and based on scientific evidence, particularly established by the ATSAC process. And so the idea of an industry trying to disprove a negative is a bit confusing to me, because I feel that those risks are well established scientifically and not something that industry would necessarily be able to disprove or should.
Yeah. So maybe a clarification question we could follow up on, but Charlotte, jump in.
Yeah, well, I mean, since Crystal just raised that, Yep. So if a company gets source testing, if DEQ has a certain emission factor for a particular chemical, and there are a variety of emission factors that are available to, for being used, and DEQ has selected a particular one, a company can do source testing and demonstrate that. But anyway, that is just moving on. But I just wanted to follow up. I just think that we're getting into this kind of like silly back and forth about, suddenly we're talking about not regulating air toxics. That is not what we are suggesting. That is not, I think it was an appropriate time to look at air toxics regulations when Cleaner Air Oregon came about. We're here talking about the fiscal impacts. Some of those fiscal impacts have been dramatically underestimated just based on, those 2018 numbers. That was before we even rolled out a program and knew what it was going to look like. So some of the ways in which that program have been implemented have significantly increased what the costs are as you're going through the program in order to get to the end and still be able to either operate or, install technology that is necessary. And so I think we're talking about more the how it's being gone about than, we're not suggesting that suddenly, this should have never been regulated, and that is not what we're saying in any way. So thank you.
Yeah, that's fair, Charlotte. All right, let's move on. And I appreciate again, y'all are navigating the conversation with respect. Let's go to the next slide. JR, is this you?
Yes. Thanks,
Yeah.
Ben. And again, thanks everybody here for this. This is really important discussion. So I make sure everybody gets to provide that feedback. So again, here we have listed the requirements for consideration of the impacts to small businesses and ways to mitigate these costs. As noted in the fiscal impact statement, the CAO program has a small business technical assistance program where DEQ staff provides assistance to small businesses when developing their emissions inventories, which can be a significant saving to these businesses as they do not need to hire consultants. And in some cases, staff have worked with these small business owners to provide the entire level 1 risk assessment, saving these businesses even more money to comply with the program. And just to sort of chime in, I think we've probably, I think I can off the top of my head think of 5 to 7 facilities that have potentially gone through the program this way. We have a form that small businesses fill out to request this. And then in addition to the direct assistance, the program has worked hard to develop programmatic resources to help businesses navigate the program and meet all the requirements. And we provide this on the program's website. So with that, I will turn it over to Ben to facilitate the discussion.
Good, thanks, JR. And I think for this conversation, maybe moving through each one at a time will make sense. And again, this is specific to small businesses. And I'll just say specific to small businesses defined by Oregon, but certainly would welcome additional thoughts. So for the first question, how can DEQ mitigate impacts by establishing differing compliance or reporting requirements, timetables for small businesses? That was poorly read, but hopefully folks are reading it on the slide and open it up for input. Liz, were you going to jump in? Was that a false flag? Unmute? Okay.
Hey, I didn't raise my hand. I'm sorry.
No, jump in, John.
Sorry, I've been quiet today. But so this one, just thinking, JR, about other states and programs out there. I think specifically of Michigan when they were developing the air toxics program. It's pretty robust, and one of the challenges they had was they implemented a 15-minute air quality standard on a couple of TACs. Now, as you know, like that low of a time frame, that's a pretty difficult modeling demonstration. And so what they had to do was first, and this was particularly for small businesses, they created quite a number of exemptions and then default templates for certain things that they expect small businesses to do, such as like a small natural gas boiler or just some sort of simple process for these small businesses to navigate. because if they're failing because of one pollutant, as Travis mentioned, like they may not be able to afford to source test to prove that that pollutant isn't there. So I'm just thinking of like, how could you assist those small businesses from not putting themselves out of business just because they want to put in a bakery or a, some sort of, and that's the best example I heard from Michigan, for example, was there were bakers that couldn't pass their air toxics modeling. So just if you could talk about maybe you can talk already, and you kind of did already, but could you elaborate more on what exemptions small businesses already have in Oregon?
Right. Thanks, John. And we'll take a look at that. I know we looked extensively at Michigan's program as a basis for this during the original rulemaking. And they do have a really robust program. So thanks for flagging that. There are no exemptions for sources in the state. The rules apply to sources that emit toxic air contaminants, unless the source has air activities that emit, say, just particulate matter, but none of it's a toxic contaminant. Those can be considered exempt. And if everything's exempt at a source, all the toxic emission units are exempt, the source itself can be considered exempt. I think right now what we do, as I mentioned, is we have provided extensive technical review and DEQ staff time to help these facilities establish their emissions inventories, which, as a lot of the consultants and sources here know, is the most challenging part. A lot of these small businesses end up being level 1 risk assessments, which is our least, it's the most conservative, least time intensive or resource intensive risk assessment exercise. It's using Excel lookup tables versus doing numerical air dispersion modeling, which requires extensive consulting time. So for us, it's that is the way we've tried to mitigate the costs thus far. And even following up with those sources during their reporting, their annual reporting, to make sure they understand how to report, what they're reporting. And so there's a lot of customer service that goes in for the small businesses.
Yeah.
But we will take a look. Thanks for flagging that. We'll take a look at Michigan's program for their small.
And John, just when we come to question 4, if there's ideas you have for where any exemptions could occur within the construct of the rules, that'll be helpful. Let's. I can't see my thing. I think it was Molly, Crystal, Jeff.
Thank you. In previous conversations today, people were talking about the expenses and the complexity of actually doing the chemical analysis at the source. One thought, since JR actually just mentioned how much technical assistance is already being provided by DEQ around modeling and emission sources and the dispersion modeling component, which is quite technical and quite expensive as well, and is a skill. I wonder if there's also opportunities to use or provide discounted source testing, because the state does actually have an incredible environmental laboratory. It's a resource in the state. So that could be another way, working in partnership, that could also help offset some of the cost of determining whether or not a facility even enters into this program. If there's the opportunity to allow DEQ to do some of that testing.
Molly, I just want to chime in. Sadly, we don't have the resources to do the source testing. The source testing that is done, that is being described, is third-party source testing. We require and we review the sampling plans and the results, but we do not have the resources to staff that testing at facilities and the equipment, and that's why it's usually contracted out.
But capturing it, I guess, Molly, to your point, right? Is there a mechanism either now or in the future to provide discounted source testing as a mitigating factor for smaller businesses? Maybe something that we just capture for the record, even if it's not possible now.
It seems like there is an opportunity to expand that within the state environmental laboratory, because it is an incredible facility. Maybe it doesn't have the right instrumentation at the moment, but that seems like either a future or at least a conversation to have, because then this could also be facilitated more quickly and also set some of that determination whether or not a facility even gets into the program using state facilities.
That's good. Thanks, Molly. Crystal and then Jeff.
Thank you. I was thinking a little bit about the term small business. I mean, that can mean a small entrepreneur or a family-run business, but it could also mean more of a structural small business, one of the risk managed structures where a corporation owns many corporations or LLCs. Either way, I think actions have consequences. If you can harm an employee within a short window, for example, such as within 15 minutes, I think it's necessary to reduce that risk. So some of these regulations are based on occupational health, and I think if the risk is so dire within a short time frame, sometimes that does need to be managed. For me, the size of emissions at the end of the day means appropriate limits should be placed on those operations to manage those harms. There is flexibility for small businesses to choose different methods of operation, but if you're big enough to have a significant harm, I think that needs to be accounted for.
All right, thanks, Crystal. Jeff.
Thanks, Ben. I wanted to follow up on something that JR said that I think is a really good idea that you're already implementing, and wonder whether we might be able to develop it further. And JR, you'd said that one of the ways that you're looking at this is by helping small businesses better understand what they're saying when they report to you triennially, and you use those reports to prioritize call-ins for existing sources. I'm wondering if there's a way that you might take it a step further. In my experience with some of these folks, they don't know what they don't know. And you all know in your team a whole lot more than they do now about what they might be saying to you. Is there a way to, within a triennial structure, reach out and double check some of the information that you might be receiving, which doesn't really pass the smell test? I'm aware of at least one source that really overestimated its own emissions of a certain TAC that caused it to be highly prioritized, which in the long run didn't end up being a TAC of real significant concern there. And I wonder just generally what you're seeing in that feedback between DEQ and the triennial reporting sources, in particular, these businesses that might not be as sophisticated as some of the others that we're all talking about or thinking about.
Yeah, thanks, Jeff. That's good. I just want to clarify, when I was speaking about the technical assistance we're currently offering, it's for facilities that like new businesses coming into the state or for existing. But your point is well taken, and we do have, air. We've got Clara Funk here, who is the air toxics emissions inventory specialist, who does do that review. And I think for us, it's, as you can imagine, it's a large amount of data. We do it every 3 years. And I think Clara and other staff work really hard to start with a tiered approach on that, to say like, wow, this doesn't make any sense. And when they see something like that, they flag it. And over time, and as they try to hone down. Your point's well taken, and I think that's something we would work towards, and I think it's something we might be able to focus on, particularly for small businesses, because I think you're right, as they don't have the environmental compliance expertise when they report these things. I think that's an excellent point.
Well, in raising it, I'm trying to think about how do you implement the rulemaking that we're talking about. Could we recraft the Clean Air Oregon rules? That's a different discussion. But it's like this rulemaking. How do you recraft? How do you try to implement it better on behalf of small businesses that might face significant impacts? To your point, maybe you could evaluate whether technical expertise could be deployed for existing small businesses presenting triennials. Is kind of the takeaway.
Yeah, I think that's a great point, and it cuts both ways. We had a recent facility, as you might know, in inner southeast Portland, that needed to immediately cease using the TCE, because when we looked at their emissions inventory, it's a small business, we found that it was above levels that were of significant concern for acute. The facility complied. They took the technical assistance. It was a collaborative solution there for them. but it was because, we ended up providing that review to them. So it does cut both ways, but I hear you, and I think that it's an excellent point, and it would definitely affect the prioritization of some of these small businesses if we looked at some of these a little closer and found that there were some corrections or revisions needed.
Sure.
Yeah, thanks, Joe. I appreciate your feedback and listening to that.
Yep. Thanks, Jeff. So it seems like we moved a little bit into question 2. I want to make sure we have time also for public input and a final roundtable. Any other questions on 1, 2, and then let me introduce number 3, objective criteria for standards. Just additional thoughts there. Introduce question 4. John, I saw you coming back on.
I just think it's
jump
just
in.
utilizing screening tools. I mean, that's just working with states that have really, mature. They're not as complex as Clean Air Oregon, but they're mature programs, and just that's what a lot of them realize is just the resource allocation to all the air dispersion modeling is very resource intensive. So they developed more and more screening tools so that you had to just do an Excel spreadsheet exercise. It was much more conservative than air dispersion modeling, but it just made it so you didn't have to get all the way down that road. I know you've got some of those, JR, but that's just my first thought is just heavy utilization of screening tools so that you don't have to get into that, especially for small businesses, if they have to avoid the cost of using consultants and lawyers, and not trying to hurt y'all's feelings. They make money
no
off
offense
this.
to
But
consultants,
that's how you would help them, right? You develop those tools, the screening tools, so that you don't have to go through this process, the whole robust process of Clean Air Oregon. Because it is really one of the more complex air toxic programs in the world, to be honest with you. I've worked all over the world. I've worked in Chile, I've worked in Europe. It's one of the most complex air toxics programs in the world. So if you can develop tools for the small businesses to get through this program on a spreadsheet, that's where you could get, one, more sources through the program so you could assess risk and help the community, but 2, you'll help the small businesses save cost. So that's just my thought.
Yeah, and Ryan, I see your comment. I agree with John Bird's comments. Thank you. Beth, jump in.
Yeah, building on that, I think there's a couple of tools that DEQ already has that they could build on. And one of the things within the regulation is that natural gas combustion doesn't necessarily have to be paired against the risk action level. So having just a spreadsheet where someone can calculate the REERs for natural gas, that's a simple one that would be unchanged in most situations. And now that can kind of be taken as a separate tool to look at. And it can also be paired up with DEQ's, I forget what the tool is actually called, but you can model very simply online. So you could make more site-specific dispersion factors, pair it up with this, and be a little how-to sheet. Anyway, I think that would be a great one, and it could be developed into just natural gas or any combustion device.
All right. Thank you, Beth. So just last on this slide, if there's any exemptions or additional thoughts on kind of less intrusive or less costly alternative application for small businesses, love to hear that. Beth, jump back in.
Yeah, so I forgot. So exemptions, what I think would be helpful is maybe DEQ puts together a database of things that they've already exempted. There is the requirement within the rule that you can present an argument to say, whatever chemical you're using or new equipment you have, it would meet an exemption, and DEQ approves that. And so maybe just having a database of what's already been approved, and facilities could go through more like a type 1 notice of construction and say, I have what's on this list. DEQ has the opportunity to review, but it would be not nearly as, I guess, time consuming to look through it.
Awesome. Thanks, Beth. Any other thoughts on the last couple questions, exemptions, or other additional thoughts on less intrusive, less costly? Okay, not seeing any. Let's go to the next slide. So we're going to ask just one last kind of wrap up conversation for the fiscal, similar to the way we framed many other questions. If there's any final thoughts that you'd like to offer, particularly if there's things that haven't been said that you'd like to bring in, that would be wonderful. And I'll just give a few moments for folks to jump in. Yeah, Jeff?
I guess I'm asking a question, which is, I interpreted the fiscal impact statement to in draft that we considered to be, I guess, inclusive of the entirety of what we've discussed, including the implementation proposals, such that it doesn't really evaluate whether, if a different implementation approach was taken, different costs would be borne by facilities currently in flight or have previously completed the risk assessment. I don't need an answer to that question unless I'm understanding it wrong, but I understood the fiscal impact statement to be, I guess, acknowledging and accommodating that implementation proposal.
I think the answer is yes. And I think really the only alternative plan that I can conceive of in the spot here that this would not be inclusive of is if facilities that had already gone through the program were not ever required to use the revised RBCs, in which case then they wouldn't be affected. But in the way that it is proposed, it's more of just the same costs will be borne, the timing will be different. So there would be interest in cost increases.
Thanks for sifting through my wordy question.
Yeah, thank you, Jeff. Thanks, JR. I'm not seeing any hands come up. Well, let's go to the next slide. Beth, jump in. But let's preview the next slide, but Beth, jump in.
I don't know if there's any good method for this, and I don't really have an idea of how it would be implemented. But I do think, facilities that have gone through the Cleaner Air Oregon process, part of the argument when we were looking at the different risk action levels, right, there's different risk action levels for an existing source versus a new source. Now these facilities that have already been through the process, but would need to review and update their sites, they would still be looking at complying with the new source risk action levels. And I'm wondering if there's a mechanism maybe specific to pollutant or specific to how we are defining these sites to kind of help mitigate that potentially costly change. I mean, some of the pollutant changes that they're a lot, right? So then it would make sense that you're going to see different results in your risk. And how is that going to be accommodated, considering the fact that you had like a backed requirement versus a layer requirement, lowest achievable versus the best available. Sorry, I'm comparing existing versus new. New has the lowest achievable and existing has best available. So an existing site would get to consider cost in the implementation of control devices. So along with that, I guess, thinking about the sites that have already been through the program, they've already established how they're going to build their facility. And now the new regulations, they need to figure potentially, right? I don't know how many of these sites have evaluated based on these new rules, but potentially they could see significant difference. So time frame for change, cost for change, all of that would be somewhat unexpected. So I guess, have we thought about that?
Is that just an open question? I don't know if that's a response.
Yes,
thank you, Beth.
Beth, I get your point. It's essentially like, at the time the new facilities they built with the current, and if their proposed RBCs require them to add controls now, you're sort of asking that the T layer, which is the lowest achievable emission rate, which does not have cost consideration, for DEQ to consider if these more aligned with the existing source requirement to use T backed, which is best available control technology, instead of T layer, as it does consider cost, because it would be a retrofit at that point. Is that kind of the summation of your?
Well, there was two parts, but yes, that is definitely one of them, but also considering the fact that the risk action level values are different for new sites versus existing sites, notably for cancer risk.
Right.
And so if there's a way to happy medium it or think about how that would
So I
transition.
so I would say submit that in writing. That would be well beyond the scope of the proposed rulemaking, and any changes to that, it would have to be a change to rule, given the way the rules are written. There's not a way to sort of implement that without an update to the rules themselves. So I would say, yes, please submit that. And it's not that we can't consider those as part of this rulemaking, it's just that we have not.
Okay, and so comments that would be submitted about language change into regulation would be considered. Yeah, okay.
Absolutely.
Thank you.
Thank you, Beth. And thanks for clarifying that point, right? That you can submit comments that include additional thoughts and recommendations. Crystal?
Thank you. I just want to reiterate that we're balancing costs of complying with Cleaner Air Oregon against the costs of healthcare. In the case of doing nothing, we would shoulder the costs of avoidable disability and deaths as well. And it's true that the cost of complying with Cleaner Air Oregon has gone up, maybe compared to the timing of this fiscal analysis. But the costs of managing healthcare and all the other associated costs have also gone up, as has everything else in our society with inflation. And healthcare costs have also gone up more than the baseline, 6 to 10% versus 3%, respectively. I also want to point out that industry could and potentially does, in a lot of cases, calculate what changes they would have to do that would result from these Cleaner Air Oregon updates. So it's possible that these controls and adjustments could be done up front for the sake of being a good neighbor proactively and protecting the public's health, rather than waiting for the updates to occur and then having to make more costly adjustments. So that is a path that could be taken. We already know what these adjustments are potentially going to be. It's well known what the associated health and deaths are going to be. And so, industry could be proactive instead of waiting and then having to adjust.
Thanks, Crystal. So for final roundtable, again, I'm going to encourage folks we haven't heard from to begin the conversation. This is kind of the last discussion that this group will have together. I know we've heard a lot of perspectives, but I want to invite folks, if we haven't heard from you, want to create some space, and then I'll ask for any additional final thoughts. Jeff, I'm going to ask you to wait for a second and see if but you'll be first in the queue. Just want to again invite anyone who we haven't heard from today, if you want to offer any final thoughts as part of this final roundtable. Jeff, jump in. Thanks for your patience.
Just wanted to strike a note of appreciation on the way out, Ben. This has been a challenging set of conversations because it's a really difficult problem to try to solve. There are good intentions and I think on all perspectives represented. And I have been grateful to participate. We look forward in continuing certain conversations in the written comments, but I did want to express the appreciation for the group to try to talk about things that are really hard. And this is a really hard set of problems to solve.
Yeah, thanks for that, Jeff. And I'll extend the appreciation to folks that have given their time, energy, expertise, heart, and wisdom to the space. Thanks for that. Other final thoughts from the group? I'm not seeing any hands, but I'll give one last opportunity. But before I do that, we do have public input space reserved that we create for these meetings. So I think we might have a slide. But I'll ask if there's members of the public who would like to offer input to the Rulemaking Advisory Committee and to extension to DEQ. I'll ask you to raise your hand. And what we will do is promote you then to a panelist so you can participate in the conversation. I see a couple hands raised, so let's promote. And we'll start with, let me see, Lotley and Mason. And we'd ask I don't see if folks have come in yet. What's the order here? Was Mason first? I mean, Mason, we start with you based on my hands. Nope, it's switched. Silali, we'll start with you. If you're speaking, you're on mute though.
Hello, can you hear me?
Yep, we got you. If you can introduce yourself and maybe stick to less than 3 minutes, 3 minutes and under, that would be wonderful.
Okay.
Floor is yours.
Sorry. Let me catch my breath. I was just stepping out of a meeting. Hello, my name is Siklali. I reside in Northwest Portland and I'm here as myself today. So I'm going to be getting real vulnerable with you and share something that many of the people in my life don't even know. At the beginning of this year, my mom's doctor found a lump in her breast. I spent months anxious, not sleeping, and terrified of what could come next. I'm sure many others here have felt that same anxiety for their loved ones. I thought to myself, we're always talking about cures, but what about prevention? What about the cure for corporate greed? Anyway, it turned out to be nothing, thankfully. A few weeks ago, she lets me know, my mom, that after years of searching, she has finally found a house that she can afford and isn't a dump, is ready to move into. Because she's been living in low-income housing in Eugene since I was a child. She's sick of it. She's sick of having, mentally unstable people right outside of her door and sick of not having anything to her own name. So I was excited, but my celebration is cut short because when she gives me the address, I see that it's sandwiched between Beltline, Highway 99, the train tracks, a wood processing facility, and tanks full of liquid fuels. So I think to myself, great, what's in her air now? What's going to give me night terrors next? Heart disease, lung disease? If I wanted to have the grandchild that she's been asking me for so much, would it be safe to even be there, having something growing inside me? Would it be safe to bring an infant there to visit? I think to myself, well, this is Oregon. The environment is a priority here. And we have Cleaner Air Oregon over 4 years in the making. That's how long it took me to get my degree. But unfortunately for my sanity, I have seen firsthand that the regulatory schema meant to protect us is a tad complicated, increasingly litigated, and much too political. So here I am. Decision makers, please hear me. Think carefully about who's telling you what and why. What are your values? What's your job? What's consistent? What sacrifices are you willing to make? And let me tell you this, it better not be our bodies. I support the TRV process. I support the science. I want to see the TRVs implemented as updated yesterday because it's time. It's my personal family's at stake, and I'm sure many of yours are. So thank you for your time.
Thank you, Zilali. Mason, we'll invite you in, please.
Hi, my name is Mason Levitt. I am speaking on behalf of Beyond Toxics here today. I have two overriding themes that I would like to get through with my comments. One is an encouragement on behalf of Beyond Toxics that DEQ maintain its current proposed TRVs. I think that the process to come up with those and seek advisory input from toxicological scientists has been very thorough and defensible, and following in line with California and Washington is a wise move for creating a level standard across the West Coast and allowing industry to meet that standard across the board. every, as documented by science and technology studies historian Sheila Jasanoff at Harvard, we could go back and forth on toxicological disputes all day and come up with 1,000 different standards if we asked 1,000 different scientists. And I think it is really important that Oregon stick with the process that it has started. It's defensible, and it minimizes the politicization that can come from advocate groups and from groups that are backed by businesses. Undoing that standard would be very dangerous for public perception of safety. And that brings me to the second point that I really want to underscore with the costs. I just want to echo sentiments made by several of the board or of the Rules Advisory Committee members today that have pointed out the healthcare costs, the mental anguish, and the safety that can be achieved through these stronger standards. I have talked to many small businesses around industries that I have worked with in communities. And, I think a really underrated part of this process is the savings and certainty that neighboring businesses are provided when we know that polluters and pollution is adequately regulated and there is a safe environment. So as we're looking at uncertainty and pollution around the facilities I work with, Coffin Butte, J.H. Baxter, et cetera, right? Businesses want to know that they are going to be safe and their employees are going to be safe and that they can safely invest in the community. And having strong toxicological standards supports that social infrastructure that lets them know that they are safe to operate. So just considering the other business and community perspectives that are impacted by these regulations, but are not necessarily on the regulated end of these regulations.
Right. Thank you, Mason. Looks like we have Rebecca Maynard. If we could promote Rebecca.
Hi, can you hear me?
We can hear you. Yep. Floor is yours. Introduce yourself, please.
Thank you. My name is Rebecca Brainerd. I am actually in rural Oregon, about an hour south of Portland. And I am here simply representing myself. I've been an Oregonian my entire life. I love this land and the people that live here, from the ambitious to the down to earth to the downright weird. And while Oregon certainly has its problems, I've always been grateful to live in a place that leads in environmental protections and standards, acting to protect our natural resources, our health, and all of the beings that live here. I would like to live in a place where I can be proud of my state for making decisions based on scientific understanding and ethics, even in the face of enormous pressure. I am also speaking as a political ecologist. If you don't know what that is, it means that I study society-nature relations, specifically focused on solving some of our most urgent environmental problems in a way that is more just, more free, and smart. Data is vital to this understanding, as are following scientific standards. Sorry, I forgot my place here. Data is vital to understanding what is facing us as Oregonians, how we are affected, and how we solve problems. Not having the best information or not following best practices for our air and water is not smart, it's not just, and it does not provide Oregonians better freedoms, only leads to illness and healthcare costs. I urge all of our decision makers to remember how critical data is, the urgency of our time within the world we live in, and to take responsibility as government and individuals to make responsible, informed decisions. Thank you for your time, and I hope you have a great day.
Thank you, Rebecca. Looks like, and hopefully I don't mispronounce the name, Sneeka. You've come off mute.
Yeah.
Yep.
Hi, my name is Snigdha Mehta. I work at an environmental consulting company called Geoengineers, and I've been working on air permitting projects across Washington, Oregon, and California. And in my previous life, I was a regulator at an air district in California. I had a few comments. the group discussed, I will start with easier one first, is the group discussed about source testing for DPM, which would be possible for an existing source. Does DEQ have any guideline or policy on DPM for new sources that have not been installed? And would they be allowing the use of certified emission rates in the engine certifications as for PM10 as surrogate for DPM? That clarity would be appreciated, especially for new sources that have to undergo health risk assessment for CAO program. This was another comment that I had in my experience working with Oregon DEQ. DEQ has a tendency to select overly conservative emission factors, and then facilities have to bear the cost of expensive source testing in order to disprove DEQ's overly conservative assumptions or choice of emission factors. So when the group was discussing, measures for, especially for small businesses to, reduce the burden of this program on those small businesses, it would be helpful if DEQ can review its currently proposed emission factors and identify new source categories that are prevalent in Oregon, and propose reasonable emission factors for them, so that facilities don't have to undergo expensive source testing. And the third and the final comment that I have is, after working extensively across the three large jurisdictions, Washington, California, and Oregon, I feel that Oregon's toxics program is overly complicated, and I feel that it is missing the forest for the trees. It is lagging because of that overly complicated program. It is lagging so far, and probably underfunded as well, and not being able to staff the program sufficiently. It is lagging so far behind in the implementation that I don't know if this program is actually serving the purpose that it was intended to, for which it was originally promulgated, the purpose for which it was intended to serve. So that's all. Thank you.
Thank you. Okay, I'll do a last call for any public input. Not seeing any hands. Let's move to closing. JR, are you going to talk next steps?
I am. Yes, thank you. And I do just want to mention, Sting, to thank for those comments. We do have data available for new sources with diesel emissions, and we can sync up outside of this, and we can provide that information to you.
Good.
Yes, so thank you, Ben, and thank you all again so much for your time. Your participation in this process is so valuable for us. I know we may not have had time to work through every discussion item in as much detail as some of you may have liked, so we will allow committee members to submit any additional information for consideration up until July 31st, after which time we will consider any submitted information during the public comment period after that, so the formal public comment period. Once we have received all the RAC inputs, we will begin drafting the proposed rules and the public notice. We're hoping that the rules go on public notice this fall, and we will be holding a public hearing then as well to receive formal public comments during the meeting, as well as written comments during the public comment period. Again, thank you so much for your participation, and we look forward to any additional information you have to provide. If you have any questions, please reach out to Apollonia Riberty or myself. And thank you, and we hope you have a great rest of your week. And I do want to address, I think, Dr. Kohlberg's comment in the chat. As far as the public is concerned, I think it was just during this time of public input, we can The public can always submit to us comments via the email for this rulemaking. But there isn't a formal public comment period until once these go out after public notice, these proposed rules. So the intent with the public input was that RAC members would be able to get to hear the input from the public as well as DEQ.
Okay, thank you, Jared. Is there any questions just around the sequencing and timeline and the distinction between what the request for RAC comments through July 31st, which will then be incorporated into what will ultimately become a public notice and a formal public comment period, but any clarifications? Okay. Thanks, JR. Well, to close out the process, thank you all. I think Jeff, you said this was a great conversation. Folks really brought, your expertise, wisdom, and passion for the work, and just really appreciate. I know felt a little heavy-handed at the beginning, asked you all to follow group agreements, but I just really appreciate you all kind of engaging in this conversation in a way that maintained a level of respect for each other and while also just really effectively bringing in your interest-based perspectives. So thank you all. It's been a wonderful journey alongside you, and wish you all the best as we go forward. So with that, it's 11:56. We will close out and send you on your way. But thanks again for being a part of this process.
Thank
Take
you.
care, everyone. Bye-bye. Take care, everybody.
Thanks, everyone.
Thank you.